Hi everyone, and welcome to my presentation. My name is Dr. Shiva Haddadian, and today I would like to concentrate on the most common cancers in women and what you can do to prevent them or find out about them as soon as possible. So let me share my slides. Okay. As you can see on the screen, our topic today is cancer prevention and recommended cancer screening tests for women. Statistics show that skin cancer is the most common cancer in the United States. Breast cancer is the second most common cancer among women, and uterine cancer is the most common cancer of the female reproductive system. However, lung cancer remains the leading cause of cancer death in women. According to National Cancer Institute, cancer is a disease in which some of the body's cells grow uncontrollably and spread to other parts of the body. Normally, body cells divide and multiply in a controlled way. If the cells proliferate uncontrollably, a mass called a tumor is formed. A benign tumor remains confined to its primary location, while a malignant tumor invades nearby tissue and is capable of spreading throughout the body. A malignant tumor is called cancer. Warning signs for cancer include unexplained weight loss, loss of appetite, new lump in your breast or armpit, thickening, irritation, or dimpling of breast skin, long-standing cough that gets worse, coughing up blood, pelvic pain, bleeding between periods, vaginal spotting or bleeding after menopause, persistent change in your bowel habits, narrow stool, blood in stool, change in color or size of a mole, or fatigue. Please pay attention. I don't talk about tiredness after a long day. I mean exhaustion that doesn't go away with rest. These symptoms don't always mean you have a cancer. Many conditions may make you feel this way, but it is safe to talk to your doctor about these symptoms and get them checked out because cancer is easier to treat when you spot it early. If you want to lower your overall risk of cancer, make these 8 lifestyle changes. 1. Stop smoking. Smoking is the biggest preventable cause of cancer worldwide. Harmful chemicals and toxins in cigarette smoke affect the entire body, not just our lungs. And there is no safe level of smoking. The amount you smoke per day and number of years you spend smoking affect your cancer risk. The good news is that it's never too late to stop smoking, and doing so will lower your risk of cancer. 2. Limit the amount of alcohol you drink. Alcohol can increase the estrogen level in the body, and according to the American Cancer Society, drinking alcohol is associated with the mouth, throat, esophagus, liver, breast, and colon cancer. 3. Maintain healthy body weight. According to research from the American Cancer Society, excess body weight is thought to be responsible for about 11% of cancers in women, and it is a strong risk factor for endometrial cancer. The timing of weight gain may also affect cancer risk. For example, some research suggests that being overweight as a teenager may be a stronger risk factor for developing ovarian cancer than being overweight as an adult. 4. Exercise on a regular basis. Many studies have shown that individuals who are physically active and exercise regularly have a lower risk of cancer. A review of research by the American College of Sports Medicine found that exercise might lower the risk of some cancers by as much as 69%. 5. Eat a healthy diet. Try to build your diet around a variety of antioxidant-rich fruits and vegetables. Limit the amount of processed and fried foods. Also, limit your intake of foods with added sugar, including sugar-sweetened beverages. 6. Practice safe sex, including condom use, and avoid having sex with multiple partners and those who have many partners. 7. Limit your exposure to the sun. And 8. Use sunscreen with an SPF of 15 or higher every 2 hours when you spend time outdoors. So, how can you lower your risk of breast cancer? Moderate to vigorous physical activity can decrease the risk of breast cancer, so exercise regularly. Since obesity increases the risk of breast cancer, try to keep a normal weight. Tobacco use is associated with a higher risk of breast cancer, especially in young women who are not menopause. So, if you're a smoker, ask your healthcare provider to help you quit smoking. Studies show that drinking even small amount of alcoholic beverages, such as beer, wine, and liquor, increases the risk of estrogen receptor positive breast cancer in women. So, an important way to lower your risk of breast cancer is to avoid alcohol. Breastfeeding can also lower a woman's risk of breast cancer. Longer duration of breastfeeding, more than 6 months, has been linked to additional reduction in the risk of breast cancer. Screenings are tests that detect diseases early before you have symptoms. Mammography is the most common screening test for breast cancer. It uses a low-dose X-ray system to see inside the breasts and find breast cancers at early stages when treatment is most likely effective. Based on American College of Obstetricians and Gynecologists guideline, average risk women should start annual or biennial mammography screening no later than 50 years and continue it until age 75. It is worth mentioning that the biennial mammography is reasonable after age 55. Now, let's talk about what you can do to prevent lung cancer. The best way to lower your risk of lung cancer is to stay away from different types of tobacco. Cigarette smoking is the main cause of lung cancer in the United States. Even exposure to smoke from other people's cigarettes or pipes increases your risk of lung cancer. Studies show that being exposed to substances such as radon and asbestos can cause lung cancer. Radon is an odorless radioactive gas naturally released from soil and water. It can get into buildings and houses through cracks in the floor and walls and build up to higher levels. For reducing radon exposure, it is wise to open windows to increase air circulation in the house and seal cracks in floors and walls. It is believed that air pollution contributes to around 3% of lung cancers in women in the United States. So if you live in a high-density urban area, pay close attention to air quality warning and news. If there is a warning, stay indoors and close all doors and windows. And if you need to go outside, wear a face mask. The American College of Obstetricians and Gynecologists recommends annual lung cancer screening for adults aged 55 to 80 who are currently heavy smokers or who have stopped smoking within the past 15 years. The only recommended test for lung cancer screening is CT scan. Cervical cancer is a type of cancer that occurs in the lower part of the uterus. If detected early, it is highly treatable. The most common symptoms are vaginal bleeding, including bleeding between periods, bleeding after sexual intercourse, and bleeding after menopause. Long-standing HPV infection is the main cause of cervical cancer, so HPV vaccine can help prevent cervical cancer. According to the American College of Obstetricians and Gynecologists, the HPV vaccine works best when given between age 9 through age 26. But the ideal age is 11 or 12. Adults aged 27 through 45 who were not previously vaccinated might choose to get the HPV vaccine after considering the risk for new HPV infection and the advantage of vaccination for them. HPV virus is transmitted from one person to another during sex. Practicing safe sex, including condom use, plays an important role in HPV prevention and cervical cancer reduction, though it doesn't give full protection. And finally, if you smoke, you are more likely to develop this type of cancer, and quitting smoking lowers your chance of cervical cancer. Cervical cancer screening tests, including pap smear and HPV DNA test, find cervical cell changes before developing to cancer. According to the American College of Obstetricians and Gynecologists guideline, you should begin to get pap smear at age 21, regardless of when you first begin having sexual intercourse. Women aged 21 to 29 should have a pap test every 3 years. Women aged 25 to 29 can do HPV testing instead of getting pap test, but pap test is preferred in this age group. Women aged 30 to 65 have 3 options for cervical cancer screening. They can have both pap test and HPV test called co-testing every 5 years. They can have only pap test every 3 years, or they can have HPV testing alone every 5 years. Now, let's talk about colon cancer. It is the 3rd most common non-skin malignancy in women and the 2nd cause of cancer-related death. Symptoms of colon cancer include unexplained weight loss, fatigue, a change in bowel habits such as diarrhea or constipation that doesn't go away, blood in the stool, or stools that look narrower than normal. Studies show that women can lower the risk of colon cancer by doing exercise and maintaining a healthy weight. Diets that are high in vegetables, fruits, and whole grain, and low in red and processed meat decrease the risk of developing colon cancer. Avoiding alcohol and quitting smoking are other effective ways that reduce your chance of getting colon cancer. The American Cancer Society recommends starting to do colon cancer screening at age 45. Healthy people with a life expectancy of more than 10 years should have regular screening through the age of 75. There are several ways to screen for colon cancer, including stool-based tests or visual exams, such as sigmoidoscopy, colonoscopy, or CT colonography. Test intervals depends on the type of screening tests. Endometrial cancer is a cancer that begins in the lining of the uterus. It is the most common genital cancer in women. The biggest modifiable risk factor for endometrial cancer is obesity. So, intentional weight loss with diet, exercise, or even with surgery and keeping a healthy weight reduce your chance of getting a uterine cancer. According to some studies, bariatric surgeries may lower the risk of endometrial cancers by 81% in obese women who stay fit after surgery. Keep in mind that pregnancy and breastfeeding cut your risk of uterine cancer. Taking birth control pills may also decrease your risk of endometrial cancer, and the longer you take the pill, the greater the benefits would be. Please note, talk with your OBGYN if you have a strong family history of cancer. Lynch syndrome is a genetic condition that increases your risk of some types of cancers, including endometrial cancer. Be aware that long-term use of unopposed estrogen without using progesterone for hormone replacement therapy increases the risk of endometrial cancer. So, if you're using any type of estrogen for treating menopausal symptoms, talk with your OBGYN about how it will affect your risk of endometrial cancer. Women with polycystic ovary syndrome are at increased risk of endometrial cancer due to obesity and abnormal hormone levels. So, ask your doctor on how to regulate your hormone levels safely and early enough to prevent prolonged exposure of the uterus to elevated estrogen levels. There are no screening tests to find out about endometrial cancer in asymptomatic women. So if you have any abnormal uterine bleeding, talk with your gynecologist and ask if a transvaginal ultrasound exam or endometrial biopsy is needed or not. Ovarian cancer is a type of cancer that begins in the ovary, the female organ that produces eggs. Unfortunately, ovarian cancer has vague symptoms and goes undetected until advanced stages, which is much more difficult to treat. There are some ways you can lower your risk of ovarian cancer. In fact, anything that stops ovulation for a time, such as a pregnancy, breastfeeding, or oral contraceptive pills, can decrease your risk of ovarian cancer. Studies show that women use birth control pills for 5 years and more have significantly lower risk of ovarian cancer compared with women who never used oral contraceptive pills. Please note, talk with your OBGYN if you have a strong family history of cancer. Lynch syndrome is a genetic condition that increases your risk of some types of cancers, including ovarian cancer. At the moment, there are no reliable screening tests to find out about ovarian cancer in asymptomatic women. You should watch your body changes, and if you have symptoms such as abdominal pain, early satiety, or difficulty eating, talk with your gynecologists. Skin cancer is the rapid and out-of-control growth of cells in the outermost skin layer. Some studies suggest that being exposed to UV radiation and the sensitivity of person's skin to UV radiation are main risk factors for skin cancer. So, the Skin Cancer Foundation recommends that you avoid being in the sun, especially between 10 a.m. and 4 p.m. Avoid getting sunburned. Sun protective clothing is the simplest way to stay safe. Wear clothing that covers your arms and legs, and a broad-brimmed hat and UV-blocking sunglasses. Use a broad-spectrum sunscreen with an SPF of 30 or higher every day, 30 minutes before going out. Don't use tanning bed, and remember, tanning may cause premature skin aging and skin cancer. If you have a personal or family history of skin cancer, history of severe sunburn, or you have blonde or red hair, light eye color, light skin tone, frequent sun exposure, or large number of moles, you may need a skin cancer screening. Skin cancer screening is a visual examination of the skin to find signs of skin cancer, such as asymmetric moles, moles with uneven color, moles that are painful or bleed easily, moles with irregular borders, or change in size, color, or shape of an existing mole or spot. And finally, vulvar cancer. It is a type of cancer that forms on the outer surface area of a woman's genitalia. HPV vaccine protects against certain types of HPV that most often cause vulvar cancer. Condoms also provide some protection against this virus. Stop smoking is another way that decreases the risk of vulvar cancer. Unfortunately, there is no reliable way to screen for vulvar cancers, so it is important to pay attention to the warning signs and symptoms, including persistent itching in the affected area that doesn't go away, an ulcer on the vulva that doesn't heal, a raised and thickened patches of skin, a lump, or a wart-like growth on the vulva. Don't forget to visit your doctor if you experience any of these symptoms. Thank you for your attention.